Today, we're tackling a critical aspect of Lyme disease that often goes unnoticed: its impact on vitamin D absorption. Join us as we explore the fascinating connection between Lyme disease and vitamin D, and discover the strategies to overcome this hidden challenge. Lyme disease, caused by a specific microbe known as Borrelia burgdorferi, has a unique ability to interfere with the absorption and utilization of vitamin D in the body. Normally, when sunlight hits the skin, it triggers a series of biochemical reactions that eventually convert a precursor molecule into active vitamin D. This active form of vitamin D then binds to vitamin D receptors located deep within the cells, particularly in the nucleus, where it regulates gene expression and plays a crucial role in various physiological processes, including immune function. Epstein-Barr virus (EBV) and certain cancers, like Lyme disease, employ similar tactics to interfere with the body's ability to utilize vitamin D effectively. EBV, a member of the herpes virus family, is one of the most common human viruses and is known to establish lifelong infections. Similarly to Lyme disease, EBV can downregulate the expression of vitamin D receptors, compromising the body's ability to respond to active vitamin D. This manipulation serves as a means for the virus to evade immune surveillance and establish persistent infection within the host. In addition to EBV, certain cancers have also been found to downregulate vitamin D receptors as part of their immune evasion strategies. By impairing the functionality of these receptors, cancer cells can create an environment that is conducive to their survival and proliferation, while simultaneously undermining the host's immune response against the tumor. One of the challenges in detecting these vitamin D receptor-related deficiencies is that they may not be readily apparent through routine blood tests that measure circulating levels of vitamin D. While blood tests can indicate overall levels of vitamin D in the bloodstream, they may not reflect the status of vitamin D receptors or the ability of cells to utilize vitamin D effectively. Specialized tests for the vitamin D receptor, however, offer a more comprehensive assessment of the body's capacity to respond to vitamin D. These tests can provide valuable insights into whether the vitamin D receptor has been compromised by pathogens like EBV or by certain cancers, thereby aiding in the diagnosis and management of these conditions. By recognizing the tactics employed by pathogens and cancer cells to interfere with vitamin D signaling, healthcare providers can implement targeted interventions to restore the functionality of vitamin D receptors and bolster the body's immune defenses. This may involve supplementation with vitamin D, as well as other strategies aimed at enhancing the responsiveness of vitamin D receptors, ultimately contributing to improved outcomes for individuals affected by EBV infection or certain cancers. However, Borrelia burgdorferi has developed a cunning strategy to evade the immune system and establish chronic infection. One of its tactics involves downgrading the vitamin D receptor, making it less receptive to active vitamin D. This means that even if blood levels of vitamin D appear normal, the ability of cells to utilize it effectively is compromised. As a result, individuals with Lyme disease may experience deficiencies of vitamin D deep within their tissues, where it is needed most for immune function and overall health. This interference with vitamin D absorption and utilization has significant consequences for the immune system. Vitamin D plays a crucial role in modulating immune responses, including the activation of immune cells and the production of antimicrobial peptides. Therefore, deficiencies of vitamin D can weaken the immune system's ability to combat infections, including Lyme disease, and hinder the body's ability to recover fully. Moreover, because routine blood tests may not detect tissue-level deficiencies of vitamin D or the downgrading of the vitamin D receptor, individuals with Lyme disease may be unaware of this underlying issue. This can prolong their suffering and delay effective treatment. In summary, Lyme disease's ability to block the absorption and utilization of vitamin D by downgrading the vitamin D receptor can have profound effects on immune function and overall health. Addressing this vitamin D deficiency is crucial for supporting the immune system and promoting recovery from Lyme disease. Overcoming the interference with vitamin D absorption and utilization in conditions like Lyme disease requires a multifaceted approach that addresses both the underlying deficiencies and the compromised function of vitamin D receptors. Here's various methods proposed to overcome these challenges. Supplementing with large intermittent doses of vitamin D, such as 25,000 IU once a week, can help bypass the compromised vitamin D receptors and ensure adequate levels of active vitamin D reach the tissues. This approach aims to overcome the downregulation of vitamin D receptors and promote immune function. Nutrients like zinc and magnesium play essential roles in vitamin D metabolism and immune function. Zinc is involved in the activation of vitamin D receptors and can enhance the responsiveness of immune cells to vitamin D-mediated signals. Magnesium is necessary for the conversion of vitamin D into its active form and supports overall immune health. Omega-3 fatty acids have anti-inflammatory properties and can modulate immune responses. Incorporating sources of omega-3, such as fatty fish or fish oil supplements, may help alleviate inflammation associated with Lyme disease and support immune function. Resveratrol, a compound found in red grapes and berries, has antioxidant and anti-inflammatory properties. It may help enhance the receptiveness of vitamin D receptors and support immune function, potentially aiding in recovery from Lyme disease. Intense exercise has been shown to have immunomodulatory effects, including enhancing immune surveillance and promoting the production of antimicrobial peptides. Regular physical activity may help strengthen the immune system's response to infections like Lyme disease and improve overall health outcomes. Cortin, a phytonutrient found in certain plants, has been suggested to enhance the activity of vitamin D receptors and promote immune function. Including cortin-rich foods in the diet or using supplements may support the effectiveness of vitamin D in combating Lyme disease. Boron is involved in vitamin D metabolism and may help enhance the activity of vitamin D receptors. Consuming boron-rich foods or using boron supplements could potentially aid in overcoming vitamin D receptor downregulation. Progesterone, a hormone involved in various physiological processes, may modulate the activity of vitamin D receptors and support immune function. Hormone replacement therapy or natural progesterone supplementation may be considered as part of Lyme disease management. Sulforaphane, a compound found in cruciferous vegetables like broccoli, has been shown to have anti-inflammatory and immune-modulating effects. Including sulforaphane-rich foods in the diet or using supplements may help support immune function and enhance the effectiveness of vitamin D. TK, a type of B salt, has been identified as a compound that can activate vitamin D receptors. Incorporating TKA supplementation may help overcome the downregulation of vitamin D receptors and improve the responsiveness of immune cells to vitamin D-mediated signals. By employing these diverse strategies, individuals with Lyme disease can optimize their vitamin D levels, enhance immune function, and potentially aid in recovery from the condition. However, it's essential to consult with a healthcare professional before making any significant changes to supplementation or treatment regimens. As we conclude today's discussion, remember that knowledge is power when it comes to managing Lyme disease and optimizing your health. Don't forget to like, share, and subscribe for more insightful content on health, wellness, and thanks for watching.